correct.
Welcome to this session, and our COP Angela also in the session. I'll let Angela say a few words. Hi. I'll let Angela say a few words, and then welcome Ida to the training. And the moderator will be Leah. Leah will be calling the shots, sort of asking people to contribute and things like that. So Angela, over to you. Karibu sana.
Thank you, Vance. Thank you, Leah. Thank you, everyone, for making time for this topic today. Not much to say except that a couple of weeks ago, I listened to Ida in one of her open webinars, and I found all the information extremely useful, and I invited her to come and do this presentation for us. Moreover, in the meeting you recently have the roundtable with the media in Tanzania, it sounded like protection for journalists is one of the biggest concerns that we have right now. So I'm really happy that Ida is available and all of you are available to attend this presentation today. I strongly encourage you to take all the information from here and share it with your colleagues, your family. It's extremely important. I believe Ida will share the PowerPoint actually with us, so everybody can do it in their own newsrooms starting today. Thank you, Ida.
That's correct. Thank you, Angela. Habari zenu, everybody. I'm Ida, as Wens and Angela have said. Thank you so much for the invitation. I feel really honored to share a bit of what I've been thinking about over the past few weeks with you. And of course, also to acknowledge that I have only been to Tanzania a few times in my life. I used to be your neighbor. I used to live in Kenya for 8 or 9 years. So that's how I got to, travel to Tanzania, and also recently to the project of Internews in Tanzania, which I found very welcoming and wonderful work. As I said, the topic is close to my heart because it's so obvious that our safety, our health, is a huge concern with COVID-19. And there is so much about this virus and this first epidemic, now pandemic around the world, that we still don't understand, that I really want to say, if what I'm about to say today to you sounds overcautious, I think I will have achieved my mission, because I think there is too little caution around how COVID-19 could affect all of us. So I've prepared some slides to talk through, and I hope there's enough time to also ask you your questions, to ask you to put to me whether you feel that what we've spoken about is relevant in your environment, maybe concerns or other issues that have arisen that all of us together can try to answer. So I look forward very much to this discussion as well. We'll go to the slides. And hope that comes across as a full screen. Does that look right, Leah or Wens? Okay, I'm going to assume that you're seeing the full screen. Of course, the picture we see, sorry, were you saying something, Wens?
Yes, I said we can see the pictures already there. Staying safe, a guide for media covering COVID-19.
Good, thank you. I just wanted to double check. We're all still learning to get this Zoom smooth, like as if we are just used to doing it every day. Anyway, so we can see journalists there covering an event. Obviously, this is already in the era of COVID. Those images have become common. In many countries around the world, masks are now mandatory, but there is, of course, has been some discussion about what it is that journalists should do while they are in a situation like that to try and stay safe. And that's exactly what we want to cover today. So I wanted to show you a slide put together, or a graphic representation put together by the Imperial College of London. They're a very credible, reputable, and highly regarded health research organization. And it kind of really is quite a sobering picture to look at, because I think what we see there is that many of the cases are incredibly hard, if not impossible to count. Now, it's been very typical for all of us, wherever we live in the world, and I'm sure everybody on this call, I myself definitely, it's been very common for us to go to those apps or the websites by our governments to check what the cases are. What are the number of confirmed cases in our country? So since you're in Tanzania, I'm sure you will all know the sources to consult to look at what the number of cases are in the country, and we watch with worry as those numbers go up. All of us do that. But what this slide shows us, and we've had the same confirmed WHO and by the CDC and by the Johns Hopkins University, who are all looking at the medical and epidemiological aspects of COVID-19 to say that really a large number of people have no symptoms, there are mild cases, and what we can therefore assume is that they are not counted. In other words, a large number of people who have been infected with the virus do not form part of the official statistics. So as soon as we're aware of that, we realize that those numbers climbing in each of our countries is not the full picture. We can absolutely assume that every single country that has its count and has its apps and has its statistics, the number of infections are actually much higher than we think. So that's already, as a journalist, as editors, that's for us quite a tough one, because numbers feel like something concrete, something real. But we just have to know, just like with TB, for example, and with many other diseases, we know the same from HIV. The official tally is not the real number. The real number is almost always higher. Now, what we have with HIV is over years, scientists have devised ways for us to say that if this is the prevalence, for instance, in antenatal clinics, then they do modeling or they extrapolate to say how many people in a given country may be infected with HIV, because we've known HIV for more than 30 years. We've only known COVID-19 for three and a half months or so. So they cannot yet model to say, if we hear that country X has 500 people who've been infected, what is the real number? They cannot yet do that modeling. So it's quite tough for us as journalists and editors to realize that the numbers we see, they're not as concrete as they may seem. And so therefore, since people are the ones who have this virus, who could be either infected or uninfected, or who could have tested or could have not been tested, we just have to realize that all of us, journalists, we are people. And all journalists, as we go out in the world and interview people, all of us as editors, at some stage we're journalists, we know our life was about being out there on the street. If at all affordable, our issue has been about being there where the story is. So as a journalist, we are a human being, and therefore we may have been exposed to the virus. We may, in addition, be exposed to the virus. So that is a very important point to recognize. It may sound so simple, but it's just what we used to say when HIV was the big story. It is still a big story, but when that used to be where our focus was, we would always say everybody is affected. Now with COVID-19, really, it is really quite possible to be infected and not even to realize it. And as we know from the global headlines, from how our lives have been changed, we definitely are all affected. So I know some of the sources that are available in Tanzania. My colleagues at the Internews office have been passing these on to me. So I'm aware of what they are, but I wanted to show you also some of the other ways in which this data can come to us. So I know this is one of the links that the Ministry of Health has made available. There are situation reports. So again, I want to say nothing wrong with Tanzania. Everywhere in the world, the situation report is not an adequate or not an accurate reflection of the number of people who've been infected. And then there are also some of those sites you may have consulted which actually compare Tanzania with other countries, or which give a global picture. And once again, it's human nature. You want to go to your own country. You want to see how your country compares to others. And then, of course, once we realize that there isn't a single country where the picture is accurate, we also realize that such comparisons are also deeply flawed. Again, it's human nature to want to look to those comparisons. For instance, here we look at Tanzania. We look at the numbers, we compare them. Maybe we feel we should compare them to Ethiopia because it's a country at a similar level of development, or maybe to Liberia or to Nigeria. And once again, we realize that even in the numbers looking concrete to us, there are so many different factors. The most important factor that tells us that these comparisons are almost useless is that countries have different levels of testing. And I wanted to go to the next source, which is, sorry, let me just move this along. This one, for example, and then the one after it. Let me skip because I wanted to quickly talk about this particular source. I don't know if you know it, but Worldometer is a fantastic source that I would really recommend because it gives us a lot of useful information, but it also gives us the limitations of some of the information. Sorry, the way it's appearing on the screen, I hope you can see what I had wanted to illustrate there. But I wanted to say that you remember a week ago we were going to have the same discussion. There is actually some good news in this Worldometer report, particularly if you take things over time. A week ago, when I looked at this graph from Worldometer, there were 10 deaths, like there are 10 deaths now recorded. But the total recovered people were about 11, if I remember correctly. I actually looked at it again this morning. And now we have that 48 people have recovered. So there in the numbers is a good story because, I mean, it is possible to measure people who've recovered because obviously these are people who've been in hospital and who've monitored. So there's a good news story there in the data. But there's a very bad news story also in this data. If you look at the very last graph. Now you'll see it relates to the tests per 1 million population. And that goes back a little bit to that triangle that I showed in the beginning. In order for us to know if a country's data is accurate, the higher this number in the right-hand column, the more accurate the data from that country will be. It's obvious. Like for instance, in Kenya, per 1 million of the population, 29,000 tests have been done. So that's a way of expressing how prevalent is testing, how common is testing in that country. So then you can already see, sorry, that was, can you see, unfortunately, the slide doesn't line up, but I encourage you to go to the Worldometer site. Let me rather not go into so much detail, but just to say that unfortunately for Tanzania, you can see that column is empty. So in your country at this stage, you don't know what ratio, what percentage of the population has actually been tested. So you can imagine if only a small population of the country has been tested, that follows that the figures are likely to be very inaccurate. If a large percentage of the population has been tested, the figures are likely to be more accurate. So it's not good news, but it's just a good awareness to have that if that figure is not known, or if the figure is low, it's again another way for us to know that what we know about numbers is not a reflection of reality. So I just wanted to go back a little bit and to say it's normal to want to compare the figures. Even though I'm saying this, and even though I know this, I still check the figures as well because we feel we can make some kind of meaning there. And of course, the most important things that the figures have told us is the numbers are going up. So I want to show you how Ethiopia does the representation of their numbers. It's a dashboard. Many other countries do it as well. I've still not seen a dashboard like that for Tanzania. And I think that if you have influence or if you have people in the tech field that you know, I think it would be a very useful service for the population to actually be able to compare things over time. So the dashboard makes it easier to follow for Ethiopians who want this figure as a country, but even for Ethiopia, that question, and even for South Africa, my country has, I think, about 2,000 people per million are being tested. In Kenya, 246 per million, and in Ethiopia, something like 180 per million are being tested. So you can tell that the South African figures are likely to be slightly more accurate, but it's still not at all enough. I think in the US, 20,000 people per million are being tested. So the figures are likely to be more accurate, but scientists are telling us it's still not nearly enough. So when we look at any of these dashboards, we should always ask what are the testing capacities in that country that we're looking at. And in addition to the known cases and the data that has been published, what does common sense tell us? Do we have some, so in other words, in the absence of accurate data, we actually have to use common sense. So a lot of what we want to discuss further today has a lot to do with common sense. And our common sense has been challenged because this virus is, this disease is new. So now language and the way that scientists communicate help us a little bit, but not so much. One of the, the terms that have come about is flattening the curve. Fine, we all talk about flattening the curve. We know what it means if you look at that graph on the left, that if we don't have a severe spike there, our systems will be better able to cope. And that is why these lockdowns have become a strategy in many countries, and countries have very different ways of applying lockdowns. You may have heard that New Zealand, India, and South Africa have extremely strict lockdowns, and other countries have very relaxed curfews or, are not enforcing any strict measures. The theory is that the stricter the lockdown, the more that curve won't go up high, especially in the beginning of an epidemic. But let's face it, who of us looked at curves like this before COVID-19? I'm not a mathematician, I'm not a statistician. Suddenly we're talking about curves that are an area of maths and science. And one of the biggest reasons why there is denial about COVID-19 is because that type of curve, which actually expresses exponential growth, is not quite a natural human thing for us to follow. Mathematicians, when they start teaching what an exponential curve is, what exponential growth is, the example that we as humans, we're much more used to linear growth. Now, linear growth works like this. If your job is to write 2 stories a day as a journalist, then by the end of the week you will have 14 stories, because Monday you have 2, Tuesday you have 2, Wednesday 2 stories, and Thursday 2 stories. There is growth there. At the end of the week you look back and you say, I've written 14 stories this week. Wow, look how productive I am. Our brains as humans can easily visualize that and can identify with that. But exponential growth means if I write 2 stories today, then tomorrow I write 4, and the day after I write 16, etc. So you know how that equation goes. But we can hardly imagine it because it's not possible to write 16 stories a day. And so mathematicians are now saying that it's partly this that is responsible for some of the denial, or some of the reasons why people don't believe the curve will go up, or they don't believe that the numbers will go up so quickly, because our minds find it difficult to actually capture that thought. So you may wonder, why am I talking about all these things about numbers and graphs and what that has to do with safety? What it has to do with safety is it's impossible for us to see the threat. Number one, we can't see the virus. And number two, it's impossible for us to really fully capture what the data is and how exponential growth actually manifests itself in real life. But if I can give you an example, the US had 1 case at the end of February, and it had 40,000 cases by the middle of April. So from 1 to 40,000 in only 6 weeks, that's exponential growth. And yet there are still people in the US who appear to be in denial about how important it is to take safety precautions. So if the world out there is so unsafe, what must we as journalists do? So especially when we're now reporting on health, we know that a basic principle in medicine is first do no harm. So if the world is unsafe and the danger is unseen, we should also realize that by going outside, we may be doing harm to ourselves. Or if we're one of those infected people with no symptoms, we may also be doing harm to the people we are interviewing around us. So that is, of course, why it came about that journalists, that the cry came that journalists should have protective gear, because they're sort of expected to be out there in the field, but yet they could be harming themselves or the people with whom they are in contact. So when we get to the discussion, I would love to hear from everybody whether what the status is with journalism and media services in Tanzania. In many countries, it has been designated an essential service. In other words, even if there's severe lockdown, those are people who are still allowed to be out there. So in my country, where we have severe lockdown, I'll give you an example. When we want to go shopping, we have to buy only few items and we can go to a supermarket. The only place I'm allowed to visit is a supermarket and a chemist or a doctor. If it's a chemist or a doctor, I must have a script from a doctor. If it's a doctor, I must be able to show or somehow prove that I'm ill and that I urgently need to see a doctor. Otherwise, I'm allowed to go to a supermarket, and then we have these queues with people standing far apart. Now, journalists don't have that, let me say, luxury. And of course, I absolutely know that in most of sub-Saharan Africa, where do we have the luxury of people being able to always be far apart when there is poverty, when people live maybe 10, 12 in one home? Those are definitely challenges or even compromises that are already being made. But still, just to get back to the idea behind it, which should be followed as far as possible, is journalism an essential service in Tanzania? Yes or no? If you know the answer, please tell me, because I don't know. And if you don't know, please find out and see what that means in terms of journalists and the precautions that should be taken for journalists being out in the field. So as I said, oh yes, I wanted to also just talk about the global concern about the safety of journalists. Is a major topic amongst all media practitioners, and of course the reason why you're here today, because of your interest and all of our interest in this subject. I wanted to show you that the Africa Regional Media Hub has put together a joint statement on the safety of journalists, and they've asked countries' editors and editor associations from countries to sign up for this statement about how journalists should be protected and how we should give alternative ways for journalists to cover stories, in other words, to help them to stay safe. Now you can see Tanzania is not a signatory to this statement. So again, that's something for an editor association to take up if you're interested, because they are taking sign-ons all the time. So that's just to say that, you know, it's a good idea to have awareness about these things. So now, as soon as essential services, as soon as that issue came up in many parts of the world, journalists started to demand personal protective equipment. Completely understandable, because if the word is that you are allowed to be out there, even in this unsafe situation, you must be protected. That would be the right of any journalist. So there is actually, you will also, I'm sure you have followed, that the initial guidance about wearing masks in public changed over time. So many people ask, so doesn't the WHO know what they're talking about? Why do they first say we don't need to wear masks, and now they say we do? But if you go to the WHO site and the CDC site, it's really clearly explained why that has changed. It's because of our evolving new knowledge about how this virus works. Now, especially because community spread is increasing in all parts of the world, now the guidance is do wear a mask in public. So now, for instance, in South Africa, as of 1 May, that's Friday, we are all mandated to wear a mask in public when we go out for this shopping that I mentioned. And of course, journalists even more so, because they're actually somehow forced to be in close proximity to people that they interview. And there are many sources online to show how face masks can be made at home, what the requirements are, what the safest way is. We all know that on our continent and many other parts of the world, there aren't enough masks to go around to just issue them for free. We could complain about it, or we could just accept that we have to work out how to make a mask and at least be safe. So this one is from the CDC. You will see WHO and CDC even have, I think CDC even has a newer one since I found this online. So please consult that site, because it is an absolute must that journalists out in the field should wear masks. So now you see those journalists that we showed in the very first slide. Yes, they're out there, they are wearing masks, but there's still something wrong with that picture because of course they're not a distance apart. Look how close those journalists, closely together they are huddled to get the story. So masks or no masks, there is something very unsafe about being out there. As I mentioned with that, and the invisibility of the virus, these are all things we know, but it's good to really stop and think about it. So now around the world, the trend for mobile journalism, which obviously is enabled through the digital era, through our smartphones, through WhatsApp, through Facebook, etc., is really gaining momentum. In other words, journalists and newsrooms who had already embraced that in the past are now in a prime position to actually keep their journalists safe. So with radio, call-in radio has always been popular. Yes, to get a signal on air for radio, you need people in a studio to get the signal for the content to be broadcast. But to actually gather the content, you don't need people in a studio. You can actually phone in. You don't need the guest in the studio. Radio has actually been a fantastic way of safe story gathering, even before we really needed to be so safe. But many startups and many very innovative people who, just sit down and think about how much you can use your smartphone have now started to gather news and information without going out there whatsoever. So the way that I like to phrase it is to say, let's be revolutionary. Let's be really new and fresh in our thinking about how news can be gathered. After all, as individuals, we tell our friends a story. We send them a WhatsApp picture of what we've been doing over the weekend. Maybe we had nyama choma or whatever, and we feel we're telling the news to our friends. Look how great it was. We sat outside and we had this party. That's a way of telling a story. We take a WhatsApp picture and we send it to friends in our WhatsApp contacts. Now, journalists are increasingly using this method to gather news and information. Of course, I'm not talking about general WhatsApp forwarded messages that come your way. I'm talking about a journalist being proactive and saying, do I have a contact who's a virologist? Do I have a contact who's a nurse? Or do I have somebody who's a store owner who can tell me the various stories about COVID? And I just ask that person to take a picture of themselves, or I just record their voice message through a WhatsApp call, or I even ask them to put a recorded voice message on WhatsApp and send it to me. If I'm a journalist, I've gathered credible information because I'm using existing contacts, but my contacts being people, but I'm not making contact with them to gather that information. So this is becoming a huge trend around the world. And I think the most important thing I wanted to bring across today, I feel it's a responsibility, is to say, encourage that as far as possible. Really, even if it feels uncomfortable, it's the safest way to do the story. And it's a way of setting a very good example. Work from home is not the same for everybody. Some people's homes are humble. Some people's homes don't have electricity, but I think most journalists have a smartphone now or have ways of collecting information that requires less contact with others. So here's an example that I took off the screen from a piece in a television piece in South Africa, just to say that here again, the journalists are wearing masks. They are also using much longer microphones. You can see the gloves they are wearing. They're using a much longer stick for their microphones, and there are, by the way, quite fabulous guidance I've seen that is forwarded to me by SABC colleagues. I used to be a journalist at the SABC, the South African Broadcasting Corporation, about how to clean those microphones, how to sanitize equipment, how to clean lenses, how to ensure that cameras that have been out in the field are safe. But as I said, there's still fundamentally something that's unsafe about even with the clean equipment, or even with cleaning equipment and with masks, because look at those two people. They're actually, ironically, they're actually having a conflict type discussion about the lockdown in South Africa. In that conflict, there's more spit flying. People talk differently. They are in close proximity. And what we've learned about this virus is that people are spitting or talking in an animated way and closely to one another. Those particles can be exchanged and one can get infected. We don't know if the guy in the pink cap and the guy in the yellow cap, if they have the virus, they don't know themselves. So that's why it can be an unsafe situation. Here is a beautiful home in a nice neighborhood, as you can tell, with all the right tools. And I really am aware that that isn't the case for many journalists around the world, including in Tanzania. But I still think one can take inspiration from people who actually have just decided. Some news organizations have decided to completely lock down. I understand BBC in Tanzania is now saying journalists work from home. This is a picture from a colleague, a former colleague of mine from the SABC, working from home. And she started gathering this from other colleagues to also start this movement and show to people how it's all possible to work from home. So it's revolutionary, and we may feel like we're not where the story is, but we are staying safe if we do that. And I believe there are a number of ways to still remain a credible journalist while working from home. With television, yes, those large cameras give us a very beautiful, sharp picture, but we've also seen pictures taken by an iPhone on television, because if the content is great, it's still compelling and people will still view it. We've already spoken about radio, the fact that radio is actually a fantastic medium to be able to just phone, use voice in a way that doesn't require going to the person, record them from the distance. With people who are doing blogs or are doing online production or online versions of stories, already those practices are familiar, because it's a matter of taking this picture, taking that audio, and making new meaning of the content. And I really wanted to emphasize, go back to the contacts that journalists should go back to the contacts they already have. It's not a matter of just grabbing anything that lands on your phone, not at all. It's that critical thinking and that ability or a skill, and actually the privilege that a journalist has to actually to be able to phone a virologist. Yes, they're sometimes difficult. They don't know if they can trust the journalist and so on. But I think with persistence, we can get all of the right credible sources and weave this together into stories. When I say we, I mean journalists. I know you're editors, but we were all once journalists. And of course, we are guiding journalists in doing this. So Skype and Zoom, I mean, the very discussion we're having here today is, and many other webinars that are now so common on Zoom, they generate news. That's a way to generate from the opinion of people, and perhaps older pictures or pictures gathered by somebody who has to be at the scene, we can put together new content. I think that if we just kind of took any normal event and we said, how can I tell that story without being there, we would quickly come up with very many possibilities. Over and above the fact that we could link up with somebody who's at the scene. Let's say we wanted to do a story about how shops are struggling because people are not visiting them. Let's say in a country with lockdown, shops are of course struggling because fewer people are going out to buy things. Of course, try to find the shop owner. Let the shop owner take a picture of their shop and you tell that story. But over and above that type of storytelling, there are even ways to tell stories not even by not even gathering any fresh material, but by taking existing material and weaving it together. We could tell a story about the data that I mentioned earlier. We could tell a story by comparing two countries which are maybe by infrastructure similar to Tanzania, but whatever we find about those countries online can be used as a story to tell, relevant obviously for the citizens of Tanzania. Another way in which COVID challenges us to think much more about safety is, of course, digital safety. I mean, it's always an issue, but now millions of people get messages weekly and are consulting the internet and are using WhatsApp more, are using Zoom more, and other tools much more. Of course, unscrupulous people, those who like to cash in on somebody else's misery, they are around in this world. And unfortunately, COVID-19 has also led to a spike in phishing and in people trying to, abuse the situation, that people are online much more and phishing for their data. So that's a whole different field. Maybe a whole different discussion could be held about that. I know at Internews, there's also a lot of expertise about this particular field. But just to say, just because we're all encouraging each other to be online, and we are much more online than before, is actually a big signal to say there are also now more threats out there. I wanted to talk about this threat of online. Is of course not just about phishing, but it's about how easy it is. You know, the World Health Organization, within something like a month of our first awareness of what was happening in Wuhan in China, started calling this disease, started saying that the infodemic is as big as the epidemic, and which became a pandemic. In other words, the overload of information and the overload of misinformation. And we often very quick to blame social media. I think I want to bet that everybody on this call has received strange WhatsApp messages where we say, where did they get this from? How can somebody believe this? But let's not forget that mainstream media can also make those mistakes. So by putting that picture there, I am not saying that prayer doesn't give us comfort and that prayer is not important. But we do know that prayer will not cure corona on its own. This newspaper, which is one of the sort of tabloids in South Africa, was trying to say there's a pastor out there who said prayer will cure corona. Now, the point is, the pastor may well have said it, but we have to consider whether headlines like that are not perhaps irresponsible, because perhaps somebody would read that and say, okay, well, prayer will cure it. But I heard a beautiful discussion actually yesterday where somebody said, perhaps we should also just consider how important prayer and spirituality and religion is to people. And we should say, well, maybe rather as journalists encourage them to pray for the scientists who are trying to find a solution, to pray for governments who are trying to find a way to encourage us to be safe, and yet not ruin the economy. So instead of, so in other words, I thought that was a beautiful thought, because that's the value of prayer, but applied in a way that also acknowledges the importance of science and processes in science. This is another example. I just wanted to say we have to find ways to stay safe from the misinformation. We perhaps don't have enough time to go into why this is misinformation, but I think it's another topic all on its own, but it makes us unsafe. We should stay level-headed and try to be sure that we know what information is credible and what is not credible. And then the last item I think we probably need to wrap up is to say another way in which we are challenged to try to stay safe is also in terms of our mental health, because the stress of disease, the stress of unemployment, the stress of the unknown is obviously having an impact on people's mental health. They get depressed, we get anxious, and it's absolutely human. So I hope as editors, you also have ways in which to talk to those who work with you, to make them realize it's normal to feel anxious, and to also be able to watch out for those cases where people are, either perhaps suicidal or definitely need, a support group or somebody to reach out to them. So mental health in the era of COVID-19 is a huge discussion out there, and we would be, we would not be honest with ourselves if we pretended that was not an issue. So I think that more or less wraps up the various areas of safety, the fact that it's an unseeable virus, the fact that the data doesn't tell us the full picture, the fact that we could consider new ways of gathering news, the fact that the false and misinformation that we get are also making us unsafe, because it can make people, grab after a cure that is not there, and then mental health. Our mental safety is very, very important to be able to get through this difficult time. And I think I want to end there. I've spoken a lot, and I really am so keen to hear any comments or, agreements, disagreements. Maybe sketching the situation in Tanzania would be a fabulous discussion. Thank you so much.
Thank you so much, Ida. Now I will let the floor to anyone who has a question or who has a comment, or if you have an additional to chip in. We are all on mute except Betty. So Betty, if you would like to start, please feel free. Betty, okay. Anyone else who has a question or a comment, please unmute yourself and feel free to talk.
Hey, Leah.
Hi, karibu.
Asante. I can see Moza. Moza is she around maybe? Hello, Ida.
Hi. Do you have
Thank
a
you for your
question?
presentation, but I'm very sorry because my internet is very poor and I can say I didn't even get you well. But I want to
Okay.
know, in this situation whereby in newsroom we are struggling, I want to know the position of HR, where the HR came in to rescue the situation. Because sometimes I find my colleagues, they are not okay to work, and sometimes they are just afraid to come even at work. So, and the HR seems like he don't know how to handle that situation. So I want to hear from you. Maybe you can advise me, whereby I can meet with my HR and discuss on how we can approach this for the betterment of our journalists and also for the organization as well.
I hear you. Look, I want to say that, you know, strictly HR practices are not a field that I have so much knowledge about, but obviously as a former editor and manager and working with HR people, I know that one of the things, and also when I started reading about the safety issues, I read a lot about mental health and COVID. And I think one of the things I read about is that one of the first steps to help people is to, first of all, just let them know that it's normal to feel an emotion or to feel anxiety. It's extremely normal to feel anxious with COVID-19. And sometimes people just want to talk about it, maybe even if you can't give a solution, but talking about it and realizing that it's okay to talk about it actually does help people. So maybe one of the things you could suggest to HR is just to say, have a discussion. Has there been a discussion in that newsroom or in your organization about how the stress affects us? It's not a solution like somebody's going to take the stress away, but I think studies have shown that people do feel some relief if they're just able to talk about it. So that is one suggestion that I can make. The other is that many newsrooms, I don't know if you all do that, have actually also decided to put people on rotation so that there's less congestion. Like, for instance, only a third of people work at any given time. So if you've done that, that is a great idea. I don't know if that helped, if that was clear, but that is what I can think of for now.
Yeah, very clear. And we have already divided into groups. Yeah. Okay. Thank you so much, Ida. And maybe I could share with my colleagues from what you have just presented for us this morning, because I miss a lot, I think, from you.
Sure. Okay.
We will share the PowerPoint. Don't worry. We will share the PowerPoint to everyone in the email list.
Thank you. Thank you.
Thanks.
Someone from Zanzibar, you want to talk, please feel free.
Please feel free.
I see Jamila Thabit. I think you're trying to unmute yourself before you speak. Oh, okay. Orest Christopher, you want to talk?
Hello.
Yes, karibu Jamila. Thank you.
Welcome. I just want to to ask a question. Hi, Miss Zida. I have a question.
Hi, how are you? Good to
I'm
see your
fine.
mask. Congratulations on wearing a mask. Thank you.
Thank you. Thank you for your good presentation. My question in the point of cleaning our equipment. You know, in Tanzania, we have a challenge of interviewing people who didn't wear a mask. Not all people wear a mask. Some people do not wear a mask. And we go through to interview them. So I just want to know how we clean our equipment, like microphones and sticks, when we go back to our working environment. When we go back to, I think you understand. So will you give me more knowledge or more clarification on how to clean them? What
Yes.
do we use? Just do we use a sanitizer or what? I hope you understand.
No, I do
hope
understand. I get you exactly. I think there are two things to say. The one is be sure to stand a distance away. You know, it doesn't feel normal, I know, because we have to hear them. We have to feel that we connect with an interviewee. That's difficult for a journalist, because sometimes we feel by getting close to somebody, we're really connecting. So COVID is rewriting all our rules as human beings, but stand a distance apart. What I will pass on to my colleagues, to Wens, Angela, and Leah, is the guidelines I found from SABC. As I mentioned, there is a whole chapter they have on how to clean equipment through items like sanitizer, how to go about. So together with a PowerPoint, I think they can send around that guidance that I found from SABC. I also saw from the Canadian broadcaster, they have something similar. So there's stuff online, but I already have gathered the SABC one, and so we can send it to you and you can study that.
Okay, thank you.
Sure.
Thank you, Jamila. Anyone else with a question or a comment? We still have like 5 minutes. So I can chip in with a question. Ida, you spoke about the importance of countries to reveal the number of cases they are testing versus the population, for us journalists to have a clear look of how big or how small the pandemic is in our respective countries. But what if there is no such data and you want to do like data journalism at these moments? What do you do? How can you go about it?
Okay, that's an excellent question. I think don't be stuck with the data you have. Rather do that data story with an explanation that around the world, you know, we all know that if we keep on doing, like, let's say, if you're in Tanzania and you keep on doing a story, the data is not adequate, the testing is not adequate, eventually people feel very hopeless with that. I think maybe what is more constructive is just to ensure that people know that the numbers that are there are not the adequate reflection. And that, by the way, is not necessarily just a failing of the Tanzanian government. It's how it is with any disease, by the way. So once you have that, I'll give you an example. In epidemiologists that I speak to regularly, because, you know, I want to be sure that I always understand this disease because of my role. He said that in public health, when they see one polio case, you know, polio has always almost been eradicated, but because there's some vaccine denial in some places or amongst some people, polio has re-emerged, as we know. In public health, they say, when they see one case of polio, they assume there are 1,000 cases. So we don't know what that is yet for COVID, but we can give an explanation and maybe compare it with other diseases and so that people, as long as people get the idea that those numbers, okay, I know for Tanzania it's currently 10 deaths. I forget now what the number is of number of infected people. As long as we actually ensure that people know that that is not an adequate reflection, we will already have done a good job. And by the way, it's not just a matter of it. There's a way of doing that story that is not just the government isn't testing enough people. Yes, it's part of the story, but it's actually not knowable in the first place. Even if, there is no country in this world which is going to test every single citizen. And since one can be a carrier and you can actually even transmit the disease without knowing, without ever being sick, we must just accept that the number is much higher than we actually know. So yeah, in the absence of good numbers of testing, there's still a way to bring across that important message that don't be stuck on the numbers. We can never know the real numbers. And if testing is low, the number is even further from the actual truth. I think that's the best that can be done right now.
I have a question, Ida.
Yes.
Given that we have to, protect ourselves and limit travel, how would you suggest that a journalist goes about, speaking to rural communities?
Yeah, no, it's very, very tough. I think what I would do in a case like that is to say, who is in touch? So like, for instance, I think what you mean is, if you wanted to do a story about a rural community and you don't know anybody in that community and you can't travel there, how do you even hear what their opinion is? Because it's not like you don't have a known contact. I've mentioned that, get contacts out there that is a doctor or an epidemiologist for that type of story. But now, if it is in a rural community and we say we can't travel there and we still want to get their viewpoints, what I would do is I would get in touch with those CSOs and FBOs, so community-based or faith-based organizations that work at a very rural level, who are after all there. So they are at least an entity we can get in touch with and hear what are they picking up from the ground, what stories are they picking up, can they give us a snapshot of how things are in that community so we can tell a story about that community. If it's about how to get a message out to that community, of course there could be an additional challenge that may be there isn't a radio station where they live, or they don't have ways of receiving news. Once again, if we know such a CBO, a community-based organization, we could actually find ways of getting the info to them, who in turn can get the information to those communities. Again, it's not a perfect solution, but I feel it's better than nothing.
Thank you. Those are very good advices. Thank you.
Thank you, Angela and Ida. Anyone else? Because the training was 1 hour. If you have anything you want to ask Ida, she's good in health in Africa. That's her specialty. I think, Ida, you should take another degree of being a doctor if you're not.
I actually would wish to be a doctor. That's what I really want to be. No, joking.
You should. You are.
No, I think our role of communicating health is so important. I just wanted to emphasize why I have this passion for this, is that I think now that the world is in this stress situation, we see the importance of communicating accurately about health, because there's a lot to panic about, but there are also good news. Like, so you see how the recovery rate has gone up in 1 week in Tanzania. And that's simply by looking at the data from a week ago and looking at the data from today. People do need hope. And there is actually a lot of hope in this COVID story. There's a huge amount of hope in the fast tracking of science and collaboration between scientists to try to find a solution, probably much faster than any disease will ever have had a solution. For us, it looks like, why is the vaccine so far away? Why is there no cure? Why does such a large number of people die? But at the same time, almost every other disease have had, the developments have happened at a slower pace. So because of the fast pace of this virus, the science is actually also happening. I mean, almost daily I read articles that people are astonished at how fast the science is advancing. So there's another good news story also about COVID.